average doctor is $300,000 in debt from medical school, and the Ontario Medical Association says the latest NDP Liberal tax grab will, and I quote, put further pressure on the viability and sustainability of a fragile system and could force existing physicians out of practice and dissuade new grads from practicing in Canada. Canadians are in the midst of a healthcare crisis. Why is the Minister of Finance making it harder for Canadians to find a family doctor?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the critic for his first question in almost a year on the matter of the healthcare crisis in this country. I could tell him that it's extremely important that nurses and doctors and that everybody pay the same tax rate, and we want to make sure that it's fair. And we've been making critical investments, Mr. Speaker, with every province and every territory, $200 billion. But in order to make those investments in our healthcare system, we need a fair and just tax system. That's why we're making sure we do that, Mr. Speaker, precisely so that we can make the investments and not have the cuts that we would see with the Conservatives.
The Honourable Member from Cumberland-Colchester.
Speaker, every week I speak to Canadians who do not have a family doctor. How is this fair? The elderly, Canadians with chronic diseases, Canadians with mental health struggles, kids with cancer, none of them can access the healthcare system. How is this fair? And the Canadian Medical Association says things are only going to get worse. They say this tax will jeopardize efforts to recruit and retain doctors. As physicians leave this country en masse, how many Canadians will go without health care due to this NDP Liberal tax grab?
The Honourable Minister of Health.
Mr. Speaker, a fair and just tax system won't threaten our healthcare system. What will threaten our healthcare system is eliminating dental care for seniors, is eliminating pharmacare, is cutting into healthcare, and that's exactly what we've seen from the Conservatives. We were able to make over the next 10 years, $200 billion worth of investments with provinces and territories. Those are put at direct risk and jeopardy because of Conservative cuts. And I find it interesting that the only time they've ever asked healthcare questions in this House is when we started talking about fairness and making sure that everybody pays their fair share.
The Honourable Member for Mégantic-L'Érable. After 9 years of this Prime Minister, over 2.3 million people don't have a family doctor in Quebec, Serge Gagné, a retiree, told Le Journal de Montréal. I was told, you shouldn't be here, you don't have a family doctor. The Canadian Medical Association is clear. In the midst of a doctor shortage, these changes could jeopardize efforts across Canada to recruit and retain quality healthcare professionals. How many families, mothers, and seniors will be deprived of a doctor by this Prime Minister because they will have chosen to practice elsewhere? How is this fair for Mr. Gagné? The Honourable Minister of Health. Mr. Speaker, for the first time, the Conservative Party is asking questions about our healthcare system. It's so interesting to me because what is threatening our healthcare system is not a fair and equitable system. It's Conservative cuts. They want to cut investments, major investments, to dental care, to pharmacare, and agreements with each province and territory. We must continue to invest in our healthcare system, Mr. Speaker.
The Honourable Member for Mégantic-L'Érable. Mr. Speaker, after 9 years of this Prime Minister, Quebec farmers are crying out for help. Instead of hearing their cry, the Prime Minister has chosen to hike taxes on them. He ignored their representatives who said categorically by increasing the capital gains inclusion rate to 2/3, we're jeopardizing the success of intergenerational farm transfers to young farmers across Canada. The Prime Minister is jeopardizing the future of regional agriculture. How is this fair to future generations of farmers? The Honourable Deputy Prime Minister and Minister of Finance. Mr. Speaker, as the daughter of a farmer, I understand the situation of our farmers, and we increased the cumulative exemption for farmers. But I'd also like to point out that Quebec has a choice. The Quebec finance minister decided to follow the federal example with capital gains because Quebec needs revenues, for example, for health care.